Hi guys, it's Miss Medic here, and today I'm going to be talking about antiemetics. Antiemetic drugs are used to prevent nausea and vomiting, and you will be often asked to prescribe these as a doctor on the wards. The three most commonly used antiemetics are cyclizine, ondansetron, and metoclopramide. Vomiting is coordinated by the vomiting center in the brainstem. Acetylcholine and histamine receptors are plentiful in this area. The vomiting center receives input from the chemoreceptor trigger zone, and the chemoreceptor trigger zone has numerous dopamine receptors. Now that we understand the basics of vomiting, we can proceed by talking about the different antiemetics. The first antiemetic I will speak about is cyclizine. Cyclizine is particularly useful in stopping nausea and vomiting caused by motion sickness or vestibular disorders. Cyclizine is an antihistamine and blocks histamine receptors in the vomiting center in the brain. It also blocks acetylcholine receptors. This means that cyclizine will have some anticholinergic side effects. It will give a dry mouth and dry throat. It is also a very sedated medication. Cyclizines have significant antimuscarinic side effects, so should be avoided in glaucoma, benign prostate hypertrophy, and urinary retention. Due to their sedative effect, they should be avoided in hepatic encephalopathy. Cyclizine is given as 50 mg 8 hourly. It can be given orally, IV, or IM. It is most appropriate to avoid the oral route if the patient is actively vomiting. The second antiemetic I am going to talk about is ondansetron. Ondansetron is a serotonin receptor antagonist. It can cause prolongation of QT interval. It should be avoided if a patient is on other drugs which prolong the QT, such as quinolone. Ondansetron is typically prescribed as 4 mg TDS, maximum 12 mg a day. Metoclopramide is a dopamine antagonist. It is another antiemetic that is frequently used on the wards. It has a prokinetic effect and promotes gastric emptying. Metoclopramide is given as 10 mg up to 3 times a day, and often antiemetics are in the PRN section of the drug periodics, but in certain patients they may be placed in the regular section. Metoclopramide can be given orally, intramuscular, and intravenously. Deperidone, another dopamine antagonist, can only be given orally or rectally. Metoclopramide can cause high prolactin levels. It should be avoided in the very young due to some reactions such as dystonia. Deperidone can prolong the QT interval. Metoclopramide is preferred over deperidone usage, and we don't see a lot of deperidone on the wards. Metoclopramide is the preferred antiemetic in this class. That concludes my video on antiemetics. I hope you enjoyed it, and if you did, don't forget to hit the like button and subscribe for more medical videos.